spread of the deadly Ebola virus is still a major concern in parts of Africa, and many questions now being raised that the virus could get airborne and be transferred into the United States. Joining us this morning to discuss the rising concerns of the spread of Ebola is Dr. Edward Kahn, the Public Medical Director with the Jefferson County Health Department and considered an authority on infectious diseases. Doctor, thank you for coming in.
Yeah, thanks, Mike.
Based on some recent comments I've read, some World Health Organization officials and the White House response to the spread of Ebola, where we're sending U.S. military help and other medical personnel. I know we may not be in panic mode, but obviously there's some elevated concerns. So what is your perspective on the way things are right now?
Well, the outbreak is definitely out of control in West Africa, in the three countries of Guinea, Sierra Leone, and Liberia. What they're saying is it's growing exponentially. The number of cases each week actually doubles from the week previously, and the number of people dying is going up that way as well. The effort from the U.S. to send people is to stem the outbreak in West Africa. It's not out of a concern that the virus is coming here, but it's to try to, basically a humanitarian effort to try to control the virus.
It's something that we're good at, right? And that's why we're sending people over there. Okay, so why haven't though we been able to, or they have been able to contain the spread of the virus so far though?
The uniqueness of this outbreak is that it's occurred in cities. Prior outbreaks of Ebola have been confined to small rural areas and villages and small hospitals, and it was able to be contained just because of the limited populations there and public health efforts. This one has hit major cities with a lot of overcrowding and not the good healthcare infrastructure to contain it, so it's just spread, you know, like wildfire pretty much.
So what is the likelihood that this Ebola virus could get airborne, spread airborne, and even possibly get into the U.S. from somebody?
Yeah, so by airborne, I mean coming on a plane and arriving.
Right.
Yeah.
Right.
So, you know, the risk exists, but it's still felt to be low. Of course, because it does have a potentially 21-day incubation period, somebody could be infected with the virus, get on a plane, arrive here, and get sick. But the overall sense that the likelihood of that is pretty low, and because of the public health measures we have in place in the U.S., we'd probably be able to contain that very quickly if it ever occurred.
What does it say though now though that some of the health personnel who, you know, they should know how to protect themselves, they themselves have also been infected with the virus?
Yeah, I don't know the answer to how the healthcare workers got it, especially those who are experts in the disease and have been working with patients for years. Either there was some sort of a breach in their personal protective gear, or maybe they encountered it outside of their patient care duties where they were not actually protected. I haven't heard any comments as to the reasons why, but I would wonder that myself.
So I'd imagine that you're thinking yourself that's a concern if health people who are dealing with the problem are actually getting infected.
Right.
Yeah. All right, now let's talk about the experimental drugs that have worked in obviously some of the patients who had this virus. How come is it not being used more widespread? And talk about what is in the experimental drugs.
Right. So the main one that people talk about is the ZMapp drug, which had, you know, limited supplies. Several doses were given to some of the infected people. First of all, there's no clear evidence that those drugs work. There's some suggestion of improvement in some of the cases, but it's not been clearly demonstrated. The drug is actually an antibody made using a tobacco virus in a tobacco plant, and then in mass-produced antibodies, which are to 3 different parts of the Ebola virus. There is a generation time of that drug where they have to grow it up and put it and harvest it from the leaves, and that's why it's in limited supply, and it takes a while before they can make more.
All right, real quickly, a lot of people travel abroad, a lot of people watching or travel abroad. What are the precautions they need to take?
Well, the CDC has put a high-level travel advisory alert for anyone intending to travel to the 3 countries, Liberia, Sierra Leone, and Guinea, and basically have said avoid all non-essential travel to those countries. As far as other countries, it's, you know, just normal precautions, awareness and avoidance of sick people, blood and body fluid type of exposure, because that's really how the disease
Wash your hands. Should people wear a
Right.
mask when they're flying?
No.
No? You don't think that's
isn't
necessary? It's not going to help anyway. Okay.
Right.
Dr. Kahn, thank you so much. Really appreciate it.
Sure,
We'll
my pleasure,
continue
Mike.
to follow this. Thank you so much.
Yeah.
All right, up ahead we